Hi, and thank you for joining us again. My name is Dr. Michael Richie, and I'm at the Richie Eye Clinic. Today, I want to talk to you a little bit about hearing. Now, we've done a little segment on hearing before, and I pointed out to you, and I'm not real shy about the fact that I myself have been in hearing aids for the last couple of years. But what I want to emphasize to most of you is, you probably don't realize that I'm in a tremendous minority. Now, I know the first thing you're going to say is, sure, you're in a minority because you have hearing loss. Reality is, 30 million Americans have hearing loss, but 80%, that's 24 million, either don't know it or don't care. They haven't done anything about it. I'm in the minority because I actually got some treatment. Now, joining me today, Jayne Bongers, our certified hearing instrument specialist. Jayne has been with us at the Hearing Center. She's the director of the Hearing Center here at the Richie Eye Clinic. She's been with us for just over a year, but Jayne has a wealth of hearing experience and has been in the hearing industry for many years here in Faribault. Jayne, thank you for joining us.
Good afternoon. Again, I'm Jayne Bongers. I've been here for just over a year. I was just going to talk for a few minutes about the signs of hearing loss. Typically, other family members are the ones that will come to you and say, gee, the television is up too loud. You might notice that you have to sit up front in church or in meetings in order to hear clearly. It may seem that everybody else is mumbling. These are some of the first signs of hearing loss.
Well, and I can add a little personal flavor to this because I was firmly convinced that my family was out to get me. They were all mumbling. Turns out, Jayne, I just couldn't hear them. Now, what about for, say, grandparents with their grandkids? What can they expect?
Hearing loss is usually greater in the higher frequencies, which is more difficult to hear women and the grandchildren. The grandchildren have those higher voices and they may speak a little bit faster. So for those with the high frequency hearing loss, it becomes difficult to hear those grandchildren.
So one of the things that Grandma and Grandpa should look for are the grandkids simply stop talking. It's too much work to try to make Grandma and Grandpa hear them. Now, I've got a different angle on that. When I'm in a crowd, if I don't have my hearing aids in, I can't follow the conversation from one person to the next to the next. So I simply step back and let the conversation go without me. That's another common sign.
That's right. Hearing in crowds has become very difficult for those with even a mild loss. That's where hearing aids come in. They have the ability to focus on the person in front of you that you're talking to and actually clip the background noise. It actually shuts down the back microphone so you're not amplifying the background noise.
Okay, so now you've brought up hearing aids. As we know, and we've talked about before, there's really no treatment to reverse hearing loss. We amplify. What options are available for somebody who's thinking about or looking into a hearing device?
Well, as you know now, all of the hearing aids are completely digital, programmable. There is a hearing aid for every type of loss. They range in, they come in many different styles, from a very tiny behind the ear hearing aid. This is one where the little bud just goes into the ear. This piece goes behind the ear.
So that's very much like what I have. That's the style I use.
Yes. They come in different channels, different strengths, like I said, from a mild loss up to a severe loss.
So explain to us, Jayne, what the different channels mean.
The different channels mean they can range anywhere between 2 and 16 channels. So if we took the audiogram and divided it 16 times vertically, that's just giving us a lot more ability to fine-tune these hearing aids.
Okay, so the channel allows the hearing aid to adjust the amplification to a finer degree.
To a finer degree.
Okay.
Again, this very
now what's that style?
This is a tiny, completely in the ear style. This one is very tiny, whereas if you look down in the ear, you probably wouldn't even see it. It's very small.
So that fits completely in the ear canal. and actually has to have a little tab on it so that when you take it out, you can reach the tab to pull it out.
That's right. This is another style that's very popular. It's called in the ear, ITC. It's just a little bit bigger, but it also allows for more options on the faceplate, such as a volume control, if you should like that option.
So the in the ear, as opposed to completely in the ear, is a bigger device, and it's going to be able to have a few more bells and whistles?
That's right. Just a little bit more power in the larger hearing aid also. The battery in the ear is a size 312, which is fairly easy to handle, whereas the completely in the canal has a small size 10 hearing aid, or battery rather.
A little harder to manipulate.
A little bit harder, very nice and indiscreet though.
Okay. So all of these are styles of hearing aids that are available. What new options do people have at their disposal now? If I was to get a new set of hearing aids now, are there other features that I could look for?
Something really neat a lot of the customers are looking at is a remote control. This is to program the hearing aid very quickly, very simply. By just having this in your hand, you can easily turn the hearing aid up or down very quickly. You can also change channels, as in, say you might have a different program or channel for if you're in a crowd, or maybe for the television or the telephone.
So, and I have a little inside story on this device. Dr. Gustafson, one of our other partners here at the Richie Eye Clinic, actually has this device, and he has figured out that his hearing aids can be a Bluetooth receptor for his television, so that when he is at home watching TV, he simply turns up the receptor in his hearing aid, not requiring that he turn up the volume on the TV. He said it's kind of fun because he's gotten to the point where his wife can't hear the television even though he's got it turned up where he needs it in his hearing aid. It eliminates the "wow, the TV's too loud" phenomenon. So that covers some of the new things, but there's a little piece of information and a new technology that may very well be coming soon. Tell us a little bit about this.
That's right. It's very exciting. We're pleased to be a part of this new technology that is coming out. Up until now, for a hearing test, for instance, your ears were tested by tone. With this new system, your ears will be tested by speech, by actual word recognition. Now, this is a huge breakthrough, as those people know out there that have hearing loss. The problem isn't really volume. You can hear the person talking. You just can't hear what they're saying. You don't understand words. And this new technology is state of the art.
Now, as you may imagine, there's a link between this technology and all the advancements in word recognition software for computers. In fact, the software technology comes from this hearing aid technology. Jayne and I were able to speak last week with the gentleman who actually holds the original patent on this information from 15 years ago. Problem is, it's taken that long to get this technology to a refined to a version that's compatible with a hearing aid and a hearing device. So next week they're coming in to help us. I hope to be one of the first guinea pigs, and hopefully I'll have a new hearing aid next week that allows me to distinguish the difference between slip and swim and soft words like that. As Jayne said, those are the keys to hearing. It isn't the volume as much as it is word recognition. Jayne, thank you again for spending some time with us. It's been very delightful, and you always have some good props that we enjoy. Thank you for joining us, and hopefully we'll have some new information for you in the very near future about this exciting new word recognition software.